in the platinum-resistant space, I think that there's increasing understanding of some of the mechanisms around why tumors are resistant to platinum, although not nearly enough.
Ovarian cancer comes with some intrinsic pathways that are already present that are mechanisms for which resistance happens. We are looking at the actual pathways that are driving that.
One of these mechanisms is related to the fact that ovarian cancers have an overexpression of this glucocorticoid receptor, GR. And we know that presence drives pathways that lead to resistance, mainly because when upregulated, the GR receptor sets off a signaling pathway that releases proteins that oppose apoptosis.
Chemotherapy really relies on apoptosis or the pro-apoptotic pathways. And if those pathways are inhibited or suppressed, the idea would be that standard chemotherapy would not be able to work. So it's interesting to think about the role of cortisol in this pathway.
It's important to realize that in the body, there's always some level of cortisol. So physiologic, completely normal levels of cortisol will impact the GR pathway, and that will lead to chemotherapy resistance by leading to the expression of genes that resist apoptosis or natural cell death.
If we have activation of the GR pathway, there is survival advantage in the cancer cell. So platinum resistance and drug resistance is actually dependent on many of these pathways, and that's why it's so important. If we can interrupt that pathway somehow, we can lead to an increase in cell death that's selective for the cancer cell.
And so if we can reuse chemotherapies that we know are effective because we have established a way to fight the mechanism of resistance, then I think that we've offered them another option.
That's resistance. We need to find something to circumvent that if we're going to kill that cancer cell.